boys against the girls.
Michele Markant plays football with her kids in the park.
Now, Jackson, you have to try and catch it, not just bat it down.
She enjoys spending time with them because she hasn't seen them a lot in the past year.
I look at them and think I don't ever want to be apart from them again.
Michelle's kids live with relatives while she was rebuilding her life. Michele, a registered nurse for the past 16 years, had a problem. A problem she was keeping from family, friends, and co-workers.
I couldn't ask for help just because of the shame.
What started out as a way to relieve pain from a nursing injury 12 years ago would eventually turn into a full-blown addiction. Michele was addicted to painkillers.
But eventually the doctors could not prescribe enough to keep me satisfied, and so I started getting them other ways.
Because Michele worked in healthcare, she knew how to call in and write her own prescriptions for the painkillers illegally. Obtaining the drugs consumed all her thoughts.
If I was out of the medication, I was obsessed. I would obtain it from neighbors, from friends, people that I looked at on the street. I was sure that they had some.
Michele's addiction led to her arrest and loss of her job.
I was using in my lawyer's bathroom when the police were outside waiting to put me in handcuffs. That's how crazy it was.
That would be the last time Michele fueled her addiction. She enrolled in the Florida Recovery Center, where she spent the next 100 days in rehab.
You finish treatment, everybody promises you these, life will get better.
Addiction expert Dr. Scott Teitelbaum helps many professionals like Michele deal with their addictions.
Professionals are hesitant, and the denial often and the success of their career and a general disdain for asking for help, because that's not how you get ahead in professionals, kind of keeps them from getting help.
Dr. Teitelbaum says treating addicts is not just about stopping the use of drugs.
It's to help people develop a design for living, if you will, to help them cope with the difficulties that we know that life gives all of us.
After 100 days of intense rehab, Michele's new design for living is paying off.
Spinal fluid.
She works as a research nurse and one day hopes to take care of patients in a hospital again.
You gonna go all the way up? Yeah. Okay, you're brave.
But for now, Michele is building a better relationship with her kids.
But my relationship with my children has only gotten better.
Michele hopes her story will help someone else struggling with a drug addiction.
If me speaking helps one other person get help, then I would speak every day.
At the University of Florida, I'm Chris Bilowich.